Okay. Hi, everyone. So our topic for today is about Get Covered Illinois open enrollment. We'll be doing a very short info deep dive about this topic. There are some new stuff that are happening this year related to it. There's stuff that are still the same as before. So we'll just be going through it quickly and sharing some resources that you could find helpful. So if you are not familiar with our organization or my program specifically, my name is Samir Zawawi from DuPage Federation on Human Services Reform. My program is about public benefit access, so we do provide training and technical assistance, anything related to public benefits. And you can find trainings on public benefit access and language access resources from our website, translated resources into many languages, recorded webinars, and online self-paced trainings. I also wanted to invite you all to join our monthly technical assistance sessions. We normally have them at the last Thursday of every month. This month, we'll change it to the third Thursday due to the holiday. Going on to our main topic. So today we will be going through the ACA Marketplace, or specifically Get Covered Illinois. We'll be going through the most important websites that would assist you to understand the program better and to know the available plans and how you can assist your clients. Open and special enrollment periods, getcoveredillinois.gov, and for sure, non-citizen eligibility, specifically DACA. So in general, what is the health insurance marketplace? You might have heard it, or you might have know it or heard the name specifically being ACA Marketplace. So the ACA is going to be for the Affordable Care Act, which is a specific act that makes health insurance, private health insurance, available for low income and one place for them to enroll and purchase these plans. So in Illinois, we have 11 insurance companies that clients can purchase their plans through. Oh, sorry, my screen just froze. Oh, perfect. So through the ACA Marketplace or Get Covered Illinois, you can enroll or change a health insurance plan. Meaning if you have a plan from before last year and you're not happy with it, this is a very good chance this time of the year to change your insurance plans to a different one. You can also know more about tax credits for private insurance or health programs such as Medicaid. You'll also be able to get answers for questions that you have about healthcare insurance. Also, the marketplace is available online on healthcare.gov. Healthcare.gov and Get Covered Illinois can be translated to different languages. And at the top of the screen of these websites, there's an option to translate it to Spanish, and Get Covered Illinois can be translated to 7 different languages. So starting with healthcare.gov, which is the main place where you can purchase insurance and look up plans. So it's going to be healthcare.gov. This is the main website. It's not only for Illinois, it's going to be for all of the states. And there's going to be questions asking you about which state you are at to provide you more detailed plan information about the plans available within that specific state. So if you go to the website and see topics, it would give you more information about how to enroll in health insurance and details such as tips and information on how to choose and enroll in any of these plans. You can find if you can enroll now. You can also find information about dates and deadlines, any type of tips, how to apply and enroll, picking a plan, and any type of coverage, and also if you are available or your client is available for Medicaid programs. Also, Get Covered button on healthcare.gov will take you to the screen to provide you can then provide information about the state you are, and then you can start making an account. So how can you make an account on healthcare.gov? So to make an account on healthcare.gov, first of all, you will have to provide basic information about yourself or about your client. The state is very important because not all states have the same plan. Not all states have the same insurance organizations or companies. So in Illinois, again, we have 11 companies available in Illinois that those who are seeking private insurance through the ACA marketplace can purchase their plans through. Information such as first and last name. First and last name has to be your legal first and last name or your client's legal first and last name. An email address is important. You cannot make an account without an email address. Then you can choose 3 questions for security and enter an answer. Very easy to create an account, not a lot of information needed. If you or your client already had purchased insurance through the ACA marketplace last year, you do not have to go through this process again. You will already have an account. So if you already have an account, you just log in. The good thing about this, I know it could be stressful to look up plans by yourself or look up plans for your clients by yourself with no assistance. That's why, thankfully, in Illinois specifically, we do have a lot of enrollment assisters that could assist clients or you to choose an ACA marketplace plan for free with no cost. So if you actually go to healthcare.gov, there is a screen that would lead you to a place with information about how to get assistance. I do not recommend going through healthcare.gov. Please go through the website that we'll be mentioning in a second, which is Got Covered Illinois, which is a specific site only for Illinois that provides information about the health marketplace, and it is also the official health marketplace for the state of Illinois currently. Why do we not recommend going through healthcare.gov if you're seeking for assistance? Because if you do select the assistance option, it will provide you information about brokers more than assisters, free assisters. There is a tab about sisters. I tested it out with Illinois, and it gave me information about only brokers. So brokers normally will try to make you purchase a certain plan, not always, but some of them, because insurance plans will be giving them money if they, enroll certain numbers or if they enroll people in their programs. So the best place to find assistance is through Get Covered Illinois. And I will be going through it shortly about how you can find assistance through this website. So for the free enrollment assistance, it's a free enrollment assistant available in Illinois. The Get Covered Illinois Navigator program would provide free enrollment assistance to everyone who is in Illinois across the state who have questions, need help enrolling in coverage, or want to change health plans. They can also find the local help tool on getcovered.illinois that I will be showing you all shortly. So this is the main website for Get Covered Illinois. It's the main marketplace for Illinois. So before this year, the ACA marketplace in Illinois was managed by the federal government. This year is going to be the first year that Illinois would be managing their own ACA marketplace. And that's why we have assisters locally and like more information and more assisters and everything. And we also have our own website. We had this website before, but it's better and more updated right now, in my opinion. But yeah. So if you go to the page, which is getcovered.illinois, you can look into specific enrollment periods. We have open enrollment, which is happening right now, and we have special enrollment, which is going to be specific periods during the year. By going to open enrollment, it would provide information about how to enroll. And if you go there, it will lead you to the healthcare.gov website, where you can look up plans and purchase a plan yourself. If you'd like, you can also see information about how to choose a health plan, or you can look up the pre-enrollment checklist. So for the pre-enrollment checklist, it will provide you information about what to look into plans, what is important for the plans, and so on, like for yourself, exactly. So this is currently happening until January 15th. So open enrollment is going to be from November 1st until January 15th. Again, just a reminder. So for Get Covered Illinois, this would help you to understand your health coverage options. Meaning, it would provide you information. It has fact sheets. It has detailed information. It leads you to other websites such as healthcare.gov that has information about these plans and so on. It also helps to access free enrollment assisters from Get Covered Illinois navigators. So if you go through healthcare.gov to find out if you qualify for financial help to lower your monthly premiums, or it can help you to see if you qualify for Medicaid. So when you do in general apply and want to purchase insurance through the marketplace, you would be screened first to see if you are qualified for Medicaid before you get the chance to purchase insurance. If you are qualified for Medicaid, then you'll start a Medicaid application through if it's online. If it's not online, with an assister will help you to apply for public benefits insurance through Medicaid. Reminder of open enrollment, which is happening now. It started on November 1st. If you'd like you or your client to start having coverage for January 1st, you have to submit an application purchase insurance, before December 15th for it to start at January 1st. Anything that is, if you purchase a plan or enroll in this program after December 15th until January 15th, your coverage start date will start at February 1st instead. So I was just mentioning a couple of times open enrollment, which is happening right now. We also have something called special enrollment. So what is the difference between these two? And does it mean that in general, can we enroll anytime during the year through the ACA marketplace or purchase a plan through the ACA marketplace? No, we cannot. However, there are special conditions or times during the year, or like when something happens, that people would be given the chance to purchase insurance during those times. So for open enrollment opens only once a year during a specific period of time. Special enrollment is normally done after a qualifying life-changing event, such as losing Medicaid, for example. Open enrollment happens during a certain set of date, it never changes, which is November 1st until January 15th. Special enrollment would be up to 60 days following the event to enroll in a plan. For example, if you or your client loses Medicaid, you or your client would have 60 days after the date you lose Medicaid to purchase a plan or to enroll into the ACA marketplace. Into an ACA marketplace plan, to be specific. So what is considered a considered a challenging life event? So a challenging life event would be such as losing a job-based health coverage. You had a job, you had insurance through your job. However, you lost your job and right now you don't have insurance. It would be hard for you to wait until open enrollment. So that's a good place. So that's why we have this 60-day period after losing your job to purchase insurance. So you can also purchase insurance through after losing Medicaid, after losing health benefits for immigrant seniors or immigrant adults. This is specifically for those who have green cards when they lost, when they were no longer eligible for this after April 30th. So this is kind of dated. After having a baby, after adopting a child, getting married, moving to a new place, or if a student is moving from a place they live to another place to attend school. And there's many other challenging life events. You can read through the slide as as you are going to receive a copy of this. So when it comes to health insurance, we do have categories. Categories mean how much you will be paying for your premiums, and how much it would be affecting you as a copay, for example. So in general, we have 4 categories when it comes to health insurance. We have bronze, silver, gold, and platinum. So when it comes so all of these 4 plans, the difference between them is how much money you will be paying for your premium. Bronze for sure is going to be the cheapest. As you go up, it's going to be more expensive. So bronze, we have silver, it's going to be a little bit more expensive. Gold, more expensive. Platinum is the most expensive plan of them all. These categories have nothing to do with the quality of care. This is only as again, just to know how much you're going to be paying, for example, for a copay, or what services are going to be covered more in your plan. So your total cost for healthcare would be depending on you will be paying a monthly bill to your insurance company, again, a premium. Even if you choose not to choose your medical insurance this month, even if you do not go to the doctor, even if you do not have a procedure, even if you do not get sick, you are still going to be paying into this premium. You will be paying out-of-pocket costs that would include also deductible for some plans when you do get care. It's important to think about these when you do choose which category that you want. So for example, before you go to apply or purchase a plan or think about meeting with an assister, think about how frequent do you need to go to a physician or primary care provider or a specialist. If you're a healthy individual and you're just going for checkups, would you be needing a platinum plan? Can you afford a platinum plan, for example? Or if you actually, let's say you do go to a lot of specialists and so on, maybe a platinum plan would be better for your case. So that means that you would not be having a lot, or the amount of money you will be paying for a copay would be much less. So we also have different types of networks, even within the insurance plan. So first of all, yes, we do have bronze, silver, gold, and platinum, but we also have something else associated with it that affects the cost of your insurance plans, which are called network types. So these are the 4 network types we currently have. HMO, which is Health Maintenance Organization, POS, Point of Service, PPO, Participating Provider Option, and EPO. So HMO, which is the Health Maintenance Organization, would most likely have the lower out-of-pocket cost compared with the other plans. The most expensive most likely will be PPO plans. This is only if we do, let's say, compare them within the same insurance company. And different insurance companies might have different prices, so we're just going to assume everyone, let's say, is under the same insurance company. So for HMO, they might have lower out-of-pocket costs than other plans. When it comes to POS, which is point of service, they could have higher out-of-costs than HMO plans. However, it would be less than PPO. EPO would be very similar to HMO. Exact prices, it could be closer to POS or HMO depending on the insurance. PPO, which is participating provider option, it would have higher out-of-pocket costs than any other plan. When it comes to primary care provider, HMO and POS networks have to have a primary care provider. It is required as part of the plan. When it comes to PPO and EPO, no primary care provider is required. They can go to specialists and everything. However, no primary care would be needed. Out of network, oh, sorry. I just want to correct something that I did speak mistakenly, which thank you so much, Robin, which is the state-based marketplace. It would start actually next year, 2026, not this year, which is that the state will start managing the marketplace. Sorry, I misspoke. Thank you so much, Robin, again. Robin is actually one of the navigators that do assist with the applications. We will talk shortly about how to find this assistance. Again, it's actually 2026, not 2025. Thank you. So out of network, so when we go to out of network, when it comes to HMO, HMO unfortunately does not provide any coverage, the same when it comes to EPO. It's only during emergency, like for example, if it's something that within your coverage cannot cover it, the insurance plan could allow it during emergency situations. POS would only be in limited cases, and PPO would be included. However, it would be at a higher cost when compared with in-network providers. Pre-approvals when it comes to HMO and POS, most likely they're going to be less pre-approvals because you would have to have a referral from a primary care to seek any type of specialist care. However, for PPO and EPO, because primary care is not required for specialists, most likely they would be needing more pre-approvals compared with the other plans. So depending on your care again and how much you are willing to pay, it is important to understand all of this. And again, the good thing about this is you do not have to go through this alone. You do not have to go through this alone with your client. We have sisters in the state of Illinois that can assist you choosing a plan and enrolling in one of these plans. So going through how to find these amazing assisters. So on Get Covered Connector, you can find an assister through this specific connector, which is amazing. It's on getcoveredillinois.gov website. If you go over here, you could provide information about you or where your client lives, how far away you are willing to travel, language needed, and how would you like this assistance? Would you like to be in person, telephonic, or Zoom? So how can you meet with an assister? So first of all, again, we're going to be providing information through a zip code. I did put Lombard zip code, which is 60148. I said in this example, I'm just willing to travel 5 miles away from where I live. I wanted the assistance in English, and I want this assistance to be in person, not nowhere else. Myra, in PPO, you do not need referrals. Approvals are usually handled by provider. Correct, you do not need a referral. However, PPO and EPO, compared with HMO and POS, would be needing more pre-approvals because you do not need a referral. That's why pre-approval from the insurance itself is more important when it comes to those specific plans. Again, sorry, I just wanted to answer that question very quickly. So when we do meet with an when you do want to meet with an assister, the first thing you do provide this information. It would then provide you all of the assisters that are close to you according to how far away you're willing to travel. It will also provide you information if you do not want to schedule online or you do not like the appointments you have online. You can also call to schedule an appointment with any of the other organizations or health departments, for examples, that are provided on the site. So for this example, I really liked the DuPage County Health Department location. I want to schedule an appointment online, so I select it. So the good thing about it, it does provide you a map. And the map it's very detailed. It gives the location, contact information, and when do you need this appointment? It would give you a date range. So I can schedule an appointment this week if I need, or next week, or within the next 30 days, or next 90 days, and so on. So for the marketplace appointment, I wanted to make an appointment with Robin Lavender, who is actually with us here today, and schedule an appointment on December 6th when it came to this example. You will need to provide information such as your first name, last name, email, which type of meeting you provide. So this sister only can meet you through in person or through Zoom. After you do provide this information, you can schedule an appointment and an email will be sent with you with the appointment details. If you need to cancel your appointment, make sure that you contact the place you schedule an appointment with and cancel it. The appointments are an hour and a half long. So I believe this would be a good amount of time for you or your client can ask you can ask you can ask the client to go you can ask the sister any questions you need, help you with the appointment, and so on. So the next example I have, if it's in another language, if you need assistance, not in English, or your client does not speak English and they need assistance. So the good thing about the website, they have an option to schedule an appointment in any other language that you might be needing, if it is available. So again, you'll select the zip code, how willing you are willing to travel, and what language you would be needing assistance with. So the language would be that the navigator would be speaking this language, not through an interpreter when it comes to this specific option. So for my first example, when it comes to other languages, I wanted in Spanish. I believe there's going to be a lot of resources, a lot of navigators who speak Spanish. And as you can see, there are a lot of resources around the area I chose. And if I don't like any of the online options, I can call and make an appointment as well. So I'm going to schedule online. I chose Rincon Family Services that's located in Kidsey. The navigator that's available is Rosa Gomez, an appointment at 11:30 to 1 p.m. And then I can schedule online. So after choosing that I want to schedule online, I can just make the same thing, provide information about your client, everything, and just go on. Let's choose another language. In my next example, I want to choose Arabic. Let's see if there's Arabic around Lombard. So when looking for help for Arabic, I might be having less options when it comes to compare to Spanish. So 10 miles away, I'll only have one option. I don't like this option, for example, so I'm just going to look further. Let's say 25 miles away. So for when it comes to 25 miles away, again, I have the same organization, but a different location. So I can choose to schedule through any of these. Let's choose another language. In this example, I chose Amharic, which is the language spoken in Ethiopia. There are no results. There are no navigators who speak Amharic in the location or near the location I chose.
¿Tienes alguna cita con alguien?
Please do make sure that you are muted. Thank you. There are no one who speaks Amharic. Let's choose another language. I chose Dari, which is a language spoken in Afghanistan. There are no results. Moving on.
sé exactamente quién te llamó. Ah, ¿me dejas tu número de teléfono y tu
Uh,
nombre
I'm sorry, can
para
you
poder
please make sure
llamar?
that you are
¿Qué es lo que tú necesitas? ¿Qué es lo
muted?
que tú necesitas?
Can you
Oh,
mute your cell phone, please?
okay, we got it. Thank you so much. Okay, sorry about that, everyone. Okay, so moving on. Um, so we are going to be, so I chose Hindi in the next option. Will I be finding anyone who speaks Hindi? Yes, there are a couple who speak Hindi. So in the case you do not find a provider who does not speak your client's language or your language, what should you be doing? This is just my recommendation. I would recommend choosing English as we did in the slide before, and choosing any of the closest appointments that you can schedule, not online, through the phone. Schedule an appointment. So you can call them and ask if they do have interpretation services. Some of them might have interpretation services, a lot of them might have interpretation services, and you can just schedule an appointment, request it in English, and ask them to have an interpreter provided. Okay, moving on. The good thing about also the ACA marketplace and during open enrollment that you can also save a lot of money when it comes to private insurance. Private insurance is very expensive. However, very expensive, specifically for low-income families. There are a lot of low-income families that are not eligible for Medicaid due to immigration status or due to making a little bit more than the Medicaid limit. This does not mean that you will be paying hundreds of dollars when it comes to your premiums. You can still be paying less if through something we call a premium tax credit. So the premium tax credit can lower your monthly plan premium for an extra saving on an out-of-pocket costs such as deductibles, co-payments, and co-insurance. A navigator, again, will be helping you going through this process by you providing all of the information needed. When you do go to the appointment or you do choose to apply online, you will be screened for Medicaid. If you're eligible for Medicaid, you can go on and apply for Medicaid through APE or go in person to any of the family community resource centers and apply for Medicaid. And also the assister, if you do choose the assister option, the assister can also help you. So when it comes to eligibility for non-citizens, US citizens, for sure, they can purchase the insurance through the ACA marketplace. How about non-citizens? So this year specifically, DACA recipients are now eligible for the marketplace, which is something new. Some additional categories for non-citizens with the following status can also be able to purchase insurance through the marketplace. Any asylum applicant, and if they're over the age of 14, they have to have work authorization. Any other non-citizen that has current work authorization, an applicant for a T visa, individuals granted parole for any length of time, and lawful permanent residents, meaning green card holders, for example, that have that status for any length of time. More information about this is going to be on the getcovered.illinois.gov website. So again, just to make sure everyone knows, DACA recipients are eligible. So DACA recipients are those who have arrived in the United States when they were children with no immigration status to protect their rights. DACA program opened. Currently, no one can enroll in this program. It is currently, they're not accepting new enrollments. Only those who are enrolled or have the chance to keep re-enrolling. They also receive employment authorization, making them able to find employment as well. I just wanted to clarify something else about the non-citizen part. your client or you have to have an immigration status if you want to apply. Even if you are applying for if you're applying an applicant for a T visa, you have to have proof that you're applying. You cannot be an undocumented person that have not applied for any immigration status and purchase an insurance. Unfortunately, you will not be eligible. So I just want to move on to the next or last section of our training today, which is about financial assistance. So when I'm talking about financial assistance, we will be talking about available resources that that could help you or your client to pay for your premium. So we will be joined by Vanessa. Vanessa is part of the DuPage Health Coalition, and we'll be talking a little bit about Silver Access Plan. So I'll just let her unmute herself and discuss, share a little
Yes.
bit about the plan.
Thank you, Summer. Yes, so my name is Vanessa Corpus. I am the Silver Access Program Coordinator. I am part of DuPage Health Coalition, and Abel Ibarra, to answer your question regarding HBIA and HBIS, the applications have now closed, and they have been closed since June, I believe. They would actually now qualify if they reside in DuPage County. They would qualify for Access DuPage. Access DuPage is a program that connects people with primary care doctors, specialists, hospital care, and low cost to free medications. Okay, and they can contact the phone number on this page, and they are able to apply for Access DuPage. All right. Unfortunately, they would not qualify for Marketplace. They do need to have legal status for Marketplace eligibility. But DACA are now able to qualify, but that is pretty much the only way for a non-citizen to qualify for Marketplace is to have DACA as well. To qualify for the Silver Access Program is a premium assistance program only available for people residing in DuPage County. We are able to assist up to $150 per person per month towards a silver tiered plan. Okay. For you to qualify for Silver Access, you do need to choose a silver tier plan with Marketplace. You do have to choose all of the tax credit for the year towards your premium, and you do need to do your taxes every year. Okay. The applications for Silver Access are open year-round. You are responsible, depending on your income and family size, you are responsible for 1 to 3 months of your premium for the whole year. Okay. Right. Enrollees are required to make the first premium payment directly to the insurance carrier for the first month to activate the policy. In this case, for open enrollment, they would have to pay the first premium for January in order for us to be able to verify the active policy and be able to make the payments on their behalf starting February. We make the payments on the member's behalf every month until the end of the year. All right. And just a reminder, the assistance that we are able to provide, it's $150 per person per month. Okay. If 2 people are under the same policy, we are able to assist with up to $300. Silver Access unfortunately does not cover for any out-of-pocket costs, any co-pays, or any deductibles. Okay, the members are responsible for their own out-of-pocket costs every time they go to get medical services. All right, and our application for Silver Access is available on our website, accessdupage.org. We are partnered with the Department of Health, as well as Worry-Free Community, as well as the Sisters in DuPage County, who are able to assist with both Marketplace and Silver Access applications. Robin Lavender from DuPage Health Department is able to assist with applications as well for both Marketplace and Silver Access, as well as her group and group of Sisters and Navigators at the Health Department. If you would like more information, feel free to visit my website, accessdupage.org/silveraccess. Otherwise, feel free to look at all the other programs that we have available. Again, Access DuPage is a great program for those that are not eligible for Medicaid or Marketplace or employer insurance. Okay. My contact information is on the page. If you have any questions, feel free to reach out. We do have all of the flyers available in different languages on our website. If you would like paper flyers for your organization or for your office, I will be more than happy to send them your way. Feel free to contact me anytime with any questions or any concerns.
Great, thank you so much, Vanessa. And again,
course.
if you'd like, yay. You can scan the barcode or the I keep forgetting what they're called, the
QR code, yes.
Thank you. You can scan it
Of course.
and also access the webpage, which is accessdupage.org. They have other programs that you can look into if you're not interested in Silver Plan. Unfortunately, you have to only be a DuPage resident, correct, for any of your programs?
Yes. For all of the programs, you do have to reside in DuPage County except for one. We have a program called Dispensary of Hope. It's in partnership with the health department as well. We provide free medication to those who are uninsured or to those who are active with Access DuPage. People from DuPage County, King County, Cook County, Will County, any county are able to come into this pharmacy and be able to obtain their medications for free.
Great. Thank you so much, Vanessa, again.
Of course. Thank you.
And also at the end, I just wanted to provide information of our upcoming webinar. We do have another deep dive. We'll be going a little bit through the public benefits online application. We'll be talking about ILUG and NABE and how they work together. So if you're interested in registering, please go to our website and register for this. And if you are already part of our mailing list, if you do already receive emails from us, you'll be receiving in the next couple of days or next week a newsletter with more information about this upcoming deep dive. Also, thank you all for joining. We do like to receive feedback in general, positive or negative. It just helps us to improve training. If everyone can please access the evaluation survey. It's also available when you do exit this training or this webinar. And we do actually have we have 10 minutes for questions. So I'm just gonna ask and see if there's any questions, I'm sorry, on the chat that I can answer right now. Also, if you did not add your full name and organization in the chat, please do so. If you are attending as part of LARC or as an interpreter, please do add your full name, and your organization would be LARC, L-A-R-C. This is for your certificate of attendance, as it has been advertised for interpreters. Thank you. Let me see what questions I do have for now. So I think I saw a couple of questions earlier. I just want to see very quickly. Can someone share the help link from the previous slide? If you mean the Get Connected, the connector one where you can find an assister, we will be sharing it in the follow-up email. And again, because I said that incorrectly, and I thank Robin again for correcting me, the state-based marketplace will start with the plan of 2026. This year, it's still federal. So Plan 2025 is still connected to healthcare.gov.
I wasn't correcting. I was just reminding all of us that it's confusing.
Oh, yeah, it is
It's
confusing.
plain confusing. It's
I
just
know.
very confusing. So, yeah, the navigators are all under a state grant, but we're not using a state-based yet. So it's confusing, Summer. It's just confusing.
Yes, thank you so much, Robin, again. And again, Robin is actually one of our sisters, and she knows a lot more than all of us combined. And she most likely she will be serving in DuPage County only, correct, Robin?
No, that's not correct. The nice
Okay.
part about assisters that are navigators is we can help anyone in the state of Illinois.
There's all of them are not I mean, like, even if it's a sisters in DuPage, they don't have to be a DuPage resident, correct?
Oh, no.
Okay.
But
just
no,
wanted to make
no,
sure.
not at all. So we actually have clients that come from all over, especially since with the marketplace, unlike Medicaid, you can do Zoom appointments, which we can't do with Medicaid anymore.
Mhm.
So it allows us to do appointments with people that are all over the state.
Okay. Oh, yeah, that's amazing.
Vanessa's nodding her head like, yeah, we get them from all over because for
Mhm.
one thing, like when you pulled up the availability,
Mhm.
there was availability. And
Yes.
a lot of places, like if you look in Chicago, because that's where I used to be, there's nothing. So
Mhm.
yes, we'll help
Correct.
anybody.
Yeah. Thank you so much, Robin. I do have a question about HMO. You can't go anywhere you want. The insurance selects the provider and the place is correct. For an HMO plan, you can choose your provider when you do select a plan. They have to only be accepting your insurance plan for sure. However, if you want to go to a specialist, your your primary care provider has to provide you with a referral within network. If you go to out of network, it will not be covered unless if it was an emergency case and your insurance has to provide pre-approval.
And
Yeah.
United Healthcare is going to confuse everybody because they have HMOs with no referrals. Now, everybody's going to think, oh my gosh, I can go anywhere I want to. No, that still means you have to pick a doctor inside the network, but you don't have to have a referral. So, I don't know. Vanessa, what do you think? Don't you think that confuses people?
Absolutely. Absolutely.
And then and then we got this POS, point of service, for the
Yeah.
first time this year. And so we're like, okay, here's HMO and it's a narrow network. And here's point of service, it's a little bit bigger. And here's
Mm.
PPO and it's even bigger. But
More expensive.
you want to, yeah, you want to be confused. Oh, and the other thing is Blue Cross Blue Shield, they didn't like anything about the new year. And so they decided to add $100 to $200 a month to people's premiums. So,
Yeah.
I mean, finding an affordable premium can be hard. It can be really hard for people. And they have to be really sure about what their doctors take. And if they're brand new to the marketplace, I usually say to them, this looks really nice, but we're going to pause. You're going to call your doctor and you're going to say, do you actually take this? Then we'll connect it. But otherwise, you're going to be stuck. I mean, you can revise it up through January 15th, but still, isn't it great to just start out the right way? Right?
Mhm. Another reason why it's very important to actually get help. As you can see, Robin Lavender and Vanessa are both very knowledgeable when it comes to it. So an assistant can also help you to choose an affordable plan, which is very good.
The other thing that we can help with is job-based insurance. If
Mhm.
y'all are offered job-based insurance or your clients are, if it's affordable, they're going to be better off 99% of the time with job-based. And we can help them figure out if it's affordable. Even places like, I mean, check it out, Walmart and Sam's Club. If you're part-time, but you've been there for a while, they have job-based insurance. So there are options for people even that are part-time. So we always ask, besides screening for Medicaid, Summer, which is super important, super, super important. We always ask, are you offered job-based insurance if you work? And then the other thing we always get, oh, it's too expensive to add my spouse and my kids. Not necessarily. So that's another thing that, there are forms and percentages and, just tools and tricks
Yeah.
that can help people figure that out.
I guess, Robin, the biggest struggle that I've had this open enrollment is dental coverage.
Dental coverage. There are only two companies, maybe three, two out of all of them that start right away. The other ones, by the way, would you pay for your car insurance and not have it for 6 months?
Or
No.
only have 1,000
No.
coverage.
Right, right. So the thing I do, and by the way, if you're anywhere near DuPage, College of DuPage has a school of dental hygiene. Their hygienists need teeth to practice on. It's $30 for a cleaning, $30 for an x-ray. So should you buy dental coverage if you only need cleanings? Probably not. If you need more, you could buy dental insurance, but then you're also going to pay attention to the fact that we have Midwestern as a dental school, and they need people's mouths to play with also. So, does dental insurance make a lot of sense? No. Blue Cross Blue Shield PPO starts right away, has varying levels. First
Absolutely.
Commonwealth out of Guardian starts right away, but it's HMO. The other part is, remember when we said check with the provider?
Mhm.
Dentists are so picky.
Very
Oh,
much so.
we don't take that. We don't take that. And if any of you deal with Medicare, which I also now start to deal with, oh my gosh, poor people. No, hardly any dental, right? So they're buying it through Delta Dental, they're buying it through all these other things. Dental is a big problem for a lot of people. I agree, Vanessa. Very good point.
Yeah.
Very good point.
So so other than basic cleanings, I know the health department has some great resources that we have available here at our Access DuPage office for those that need low-cost dental services.
And we
You can
have a
contact
clinic.
Robin.
And
Yeah,
we have a
yeah,
clinic. So
exactly.
if you don't have dental insurance or you have Medicaid, especially if it's an emergency, call us. And I'm going to put our phone number in there, but call us. We have a dental clinic in Wheaton. We also have it one day a month in Lombard. But, and then we have these van that goes to all the schools and screens all the kids for their, dental health. But yeah, it's just, it's such, I don't want it, racket's not the right word, just a very narrow network. Is that a good way to say it?
Yes, yes. But Robin, just to make a last point, there are plans available in the marketplace that are silver tiered and do qualify for us the full silver access assistance. There's plans in marketplace that have vision and dental along with medical.
Oh, correct,
Um,
correct. But if they're
So that is available.
better,
Yes.
if they're better, just remember which one of the 7 plans in DuPage just paid a $50 million fine for having a narrow provider network and not being good with customer service. If you have anything like that going on, be careful. Just be careful.
We do have a question about specifically the dental programs you've mentioned. Can anyone from Cook County benefit from these places?
College of DuPage, yes. They don't care where you come from. They just want mouths for their students to work on. Midwestern, Vanessa, do they take anyone?
They do. Loyola University also has dental services as well.
Yeah, U of I, but it's got a long waiting list. But yeah, U of I has great dental clinics down there on the campus.
Yeah. Abel,
yeah.
I recommend contacting the health department. They're going to give you a list of low-cost dental clinics
Right.
and services in Cook County.
Yep.
Okay, great. Thank you everyone for joining and specifically for Robin and Vanessa for sharing their wisdom. I will be collecting all of the questions that are in the chat. If you have more questions, you can reach out directly to me. My email was on the registration list and I'll add it over here again. You can also contact Vanessa, right, Vanessa?
Absolutely. I will put in my contact information on the chat. I apologize I haven't done that sooner.
Yeah, for sure. And do you want people to contact you, Robin, or not?
Yes, any
Sure.
questions, I will put in my email address as well. Probably
I will
faster
too.
by email. Yeah.
Mhm.
And Summer, thanks
Yeah.
for doing this. Oh my gosh, I am like so amazed. God bless you. Well,
Yes.
bless